Hi, I'm Dr. Kevin Ho. I'm a ear, nose, and throat specialist. First, I'll talk about how to protect your ears. Very common things I see especially in this Chinatown community, is hearing loss. And the main reason for gradual decrease in hearing, especially in an elderly, is a degeneration of the hearing nerve, which is a part in the inner ear, and this is called the cochlea, also in the inner ear. So some of them, the reasons are genetics, but a lot of them is due to noise exposure when a patient is young. For example, they work with a lot of machineries, or if they are in the army or work with a lot of different machines, and that would cause gradual decrease in someone's hearing and can affect the hearing nerve. So an important thing for a patient is to realize that they don't want to turn the volume of their earbud or their MP3 player too loud, even when they are young, because I see an increasing trend of hearing loss in younger patient populations. The second thing I want to talk about is how to remove earwax, and about how to protect the outer part of the ear, called the ear canal. A lot of my patients use Q-tips. Q-tips are actually not designed for outer ear use. If you read the fine prints in the box, a lot of people don't read that. Q-tips, what happens is the wax normally will migrate from the inner part of the ear canal to the outer part, and you can simply use a cloth to remove the wax on the outside without using a Q-tip. The problem with the Q-tip is that it would push the earwax deeper, almost to the eardrum area, and sometimes I have also seen patients damage their eardrum with the Q-tips. In some patients, if the earwax are very thick, I would recommend them to use some ear drop products to soften the wax, and they will gradually come out. But if the earwax are too much and cause hearing loss, sometimes they have to find one of us, the ear doctor, to help them irrigate or suction out the earwax so that they can hear again. Some of the newer technologies available for the ear, it's called cochlear implant. It applies for the inner ear cochlear part, where if someone would have, for example, congenital, severe, or profound hearing loss, we can place a cochlear implant into the inner part of the ear and stimulate the cochlea and the hearing nerve. So for someone who's born deaf, this technology can restore someone's hearing very efficiently if it's corrected at a young age. So this is probably the most advanced technology we have for the ear right now. So one thing very common I see for the nose is stuffy nose. Someone would come in with a stuffy nose or a running nose, and it's due to the fact that there are different structures inside the nose. For example, this is called the nasal turbinates. The lower nasal turbinates can get swollen due to a variety of reasons. For example, allergies is one of them, and that can cause the nasal turbinate to become swollen and block someone's airway. A second thing I see very common is nasal polyps. Nasal polyps is formed by chronic inflammation of the nose, and the symptoms of nasal polyps are stuffy nose and also decrease in the sense of smell. So if a patient have those two symptoms, I would encourage them to see a doctor to see if they have a nasal polyps or something growing in the nose. Third condition I see very common is nose bleeding. It can happen in a young child and can happen in any age. One thing I see is that patients sometimes they like to blow their nose very hard, or they like to pick their noses. When they do that, the blood vessels in the front of the nose can get loose, and those blood vessels can nosebleed if they cause any trauma to the blood vessels. So very importantly, I would encourage those patients to not pick their nose or blow their nose very hard, or to apply some ointment to the front part of the nose for moisturization. Sometimes nose bleeding can be caused by growth in the nose. In Chinese population, especially where I was from, Hong Kong or Guangdong region, there's a condition called nasopharyngeal cancer, and it's caused by a cancerous growth in the back of the nose called the nasopharynx, and that has to do with genetic reason and also has to do with a virus. So in those situations, patient can experience some nosebleeds, and they also will experience some blockage of the eustachian tube, and that can cause someone to have a ear blockage as well. In a late stage, they may develop a neck mass in the neck. So if someone have those symptoms, I would also encourage them to find a doctor right away. The latest technology for nasal surgeries, or what we call the minimal invasive nasal surgeries. For nasal sinus surgeries in the past, many years ago, sometimes we have to go outside of the nose to make the incisions. Right now, we can hide all the incisions inside the nostril. We can do everything from inside the nose with a very small camera. We can remove the pathology or the nasal polyps or any growth in the nose just through the nostril. And the healing time is usually much less, and the bleeding is very much less than before, and the patient can usually go home on the same day. So an important thing about the throat is that I see a lot of patients with hoarse voice. The most common reason is that they use their voice in a wrong way, meaning that sometimes they yell, or they really raise their voice, or sometimes they use the wrong part of their throat to talk instead of using the abdomen or the diaphragm to drive a person's sound. And that can cause patient to have a vocal fatigue, and sometimes in a very severe situation, it can also cause voice nodules or growth in the voice box area of the vocal cords. In those situations, those patients may need to undergo speech therapy so that they can relearn how to use their voice. And if that's not successful, sometimes we may take the patient for surgery to correct those situations. Another common situations I see is laryngeal reflux or acid reflux disease into the larynx. What happens is we have stomach contents or stomach acid that refluxed back up into the throat, and patient usually would have symptoms of a foreign body sensation in their throat, or they may need to clear their throat a lot, or they may have a hoarse voice. In those situations, I would first encourage patient to change their lifestyle. For example, reduce the amount of spicy food or caffeine consumptions, or avoid eating too late, close to bedtime. I would also prescribe them medication to reduce the acid reflux, and I would also encourage them to protect their voice by also observing the vocal hygiene, by not raising their voice, and also by drinking more fluids for their throat. Another condition I see is tonsil infections. If someone having tonsil infections a lot, usually it's because they have either enlarged tonsils, or they have a lot of irritants in their diet. So first of all, I recommend them to reduce the amount of spicy food or fried food in their diet, and also they can rinse their mouth after they eat. Sometimes that's not enough and that can cause infection of the tonsils. So we would prescribe some antibiotics for them to improve that situation. For someone with repeated infections of the tonsils, we would recommend removing the tonsils. So that can also reduce the chance of getting more infections in the future. The latest technology for the throat is also geared towards minimal invasive surgery that we can use latest technology, either a radio frequency ablation or laser, to remove tissues such as tonsils or growth in the voice box area. And those would also have no incision in the neck. We can simply do all the surgeries in the throat. And sometimes we can do the surgeries in the office too, under minimal sedation. And the patient, again, will do well, and they usually recover very well and can go home on the same day.